As we mentioned earlier, February is Heart Health Month, and the American Heart Association wants you to go red for women. The Go Red for Women campaign was born in 2004 in an effort to dispel the myth that cardiovascular disease is an old man's disease. Cardiovascular disease claims the lives of nearly 500,000 American women each year. This is the 9th year for the Go Red for Women campaign. How successful has it been? According to their website, since 2004, 21% fewer women are dying from heart disease, and 23% more women are aware that it's their #1 health threat. Dr. Charlie Hahn of Veins, Florida, explains how cardiovascular disease and chronic vein diseases like varicose veins and deep vein thrombosis often go hand in hand.
For the vein patients, they tend to have multiple symptoms and multiple problems, and we have a variety of ways to treat them. Varicose veins, those are large veins. They tend to be usually running down the leg. Spider veins, those are the tiny veins that just barely underneath the skin, and they tend to be in clusters, like the veins on the leaf. And the varicose veins, they tend to be more like a river run down the leg. Varicose veins can cause blood clots in them, and then they cause a tremendous amount of pain once the blood in them become clots. And we call the Thrombophlebitis. For thrombosis, the varicose veins, they carry a large amount of blood, and that's why those veins are huge. And a lot of times they stay there for a long time. And for some patients, they can develop a large blood clots, which is not as dangerous as the deeper vein thrombosis. Deeper vein thrombosis, the clots that are located within the deeper vein, usually they're in the pelvis, and those clots can travel to the lungs, which can cause pulmonary embolism. For varicose veins, they tend to be superficial. Those blood clots tend not to travel. As long as you move around, the leg muscle, they're pumping, and they will sort of like acting a muscle pump, and they pump the blood and back and forth, and that will decrease the chance of blood clots. I would say about sitting like 3-4 hours, and then you get up and walk around at least about 20 minutes, 30 minutes.
You'll find the contact information for Veins, Florida, along with the link to Go Red for Women when you click the Chronic Vein Diseases Story Icon link on our homepage, yourhometownhealth.com.